Hey everybody, it's Dr. Grunman with Integrated Health Solutions. Today I wanted to talk within our blog about the definition of function. And the way I look at function, it is the excellence of movement without side effects. And if you tend to have good movement, a movement screen in our office is going to come back clean. So what we want to do is invert the definition of function and look at dysfunction. Sometimes people might have good movement through a movement plane, overhead movement from their shoulder, side movement from their shoulder. It's completely clear. But what we try to focus on is particular muscle engagements that might be compensating. There are quite a few elite athletes that come through the city of Indianapolis, and they might come into our office showing some masterful compensations. And they are probably the elite of the elite when it comes to accomplishing movement patterns to get the goal done of whatever they're trying to accomplish. And when that compensation sets into place, it could lead to a bit of dysfunction down the road. And what we try to focus on is making sure that there is a proper synchrony of muscle engagement throughout an entire joint plane. Because if there is that improper movement, it may lead to decentration of a joint. Going back to the shoulder, if we're not properly engaging our pectorals and our scapular muscles, it might lead to an anterior or posterior settling of that joint, which creates a little bit of dysfunction over time, and that could lead to a shoulder impingement. It could lead to people having issues with frozen shoulder and things like that as well. So what we would focus on is proper movement patterns and making sure that people are engaging the proper tissue, making sure that the rotator cuff is engaging well together so that they don't have that decentration of the joint leading to possible pathology later on in life. And after a pathology sets in place, generally we see a neuromuscular discrepancy. And that is what I had referred to earlier as that desynchronization of tissue throughout the joint plane. It's not engaging well. All of the tissue that should be stabilizing that joint is not playing together. They're almost fighting against each other on opposite teams. So what we want to do over time, if there is a chronic issue that sets in place because of these compensations, we want to reorganize the muscle engagement to make sure that the brain recognizes what it's doing to the body, trying to stifle that protective pattern that leads to a lot of dysfunction and perpetual pain that patients have. I had an example of a patient who was about 6 months removed from a shoulder surgery. He had a rotator cuff injury. And when the rotator cuff was repaired, he went through PT and ended up reaching a plateau in his care to where he could not reach his arm completely overhead. And you could see that his lat, his upper trap started to shrug, his lat started to quiver. And a lot of the tissue of his shoulder blade was not working in conjunction with each other to help give him that achieved goal of full overhead movement, because that body would start to shake and it was fighting itself. So what we tried to focus on the most was making sure that he had better control of that tissue, going through passive ranges of motion, active ranges of motion. And when he could accomplish both of those in a much more controlled fashion, we started to add a little bit of weight. We didn't want to jump to weight too early. We wanted to use resistance bands at a very low rate and accomplish that overhead goal, external, internal rotation, and make sure that we were really focusing on those muscles of the entire unit itself as they were working at play, and not just poking at specific muscle groups to try to engage that, because it's almost impossible to engage one particular muscle group. We wanted to get the whole unit engaged itself. So as far as wrapping up the topic of dysfunction and function, I wanted to make sure that the point was driven home that it's okay to have compensation just as long as you are getting a proper screening to make sure that that movement is fully capable, you are accomplishing the goals at hand without too much engagement and too much protection from your brain telling the body to seize up that tissue, and focus on essentially a clean slate, making sure that you have that proper movement pattern and engagement.